Within some of our healthcare facilities, there are systemic and totally unacceptable lack of integrity. I apologize to our veterans, their families, and their loved ones.
Mr. McCluskey, I kind of feel sorry for you being here today because you're really representing a system that really has no defense.
The breakdown comes when I have to be very honest with you. I think I've proven myself of trying to get this right when I am seen as more of an obstruction and a nuisance to answer questions when we call over to try and get them, instead of being a partner to fix this.
To date, we have ongoing or scheduled work at 69 VA medical facilities and have identified instances of manipulation of VA data that distort the legitimacy of reported waiting times. When sufficient credible evidence is identified supporting a potential violation of criminal law, we are coordinating our efforts with the Department of Justice.
I just think it's going to be so hard. I think that this culture of bureaucratic incompetence and corruption is so deep. Every hearing I've had prior to this, it's deny, cover up, and then delay giving any information to us.
Millions of dollars have been wasted on contractors trying to create a better system for capturing this data.
I think it's important to understand that our scheduling system scheduled its first appointment in April of 1985. It has not changed in any appreciable manner since that date.
VA has requested and Congress has funded IT enhancements to include a new scheduling system, which has been dubbed a failure by GAO. The scheduling replacement project was $127 million over 9 years. Why are we still using outdated systems when we have given hundreds of millions of dollars to the VA?
Where the heck is the money, the billions with a B dollars that this Congress and previous Congresses have allocated to IT upgrades?
Where's the big idea for reform? Because if you're going to come here and ask for technology money, that was a cursory thing they found. When they pulled the testimony of the people who sat there and the questions that I sat here and asked about technology, you are going to be embarrassed, and my guess is you will not want to come and ask for that money.
I think the big idea, it may not sound like a big idea, but it is back to basics. Back to delivering safe, quality healthcare in a timely manner, knowing where we can achieve that, where we cannot.
So when we get to this 14-day wait period, and then I heard that its quote was simply not attainable, unquote. What is realistic?
I honestly don't know tonight. I do know what is unreasonable. I think 90 days is unreasonable. I think 60 days is unreasonable.
Once someone loses his job or gets criminally charged for doing this, it will no longer be a game, and that will be the shot heard around the system.